Yeah, I think what
I
you're
would have had a
describing is,
similar
is
thought
just a
process.
general sort of public servant kind of approach, or dealing with government at all. Like, I was involved with justice and education and health on and off for the last 25 years. And the bits that get
Yeah,
me, they really get me, I get mad about it, is when we change government and you think, all right, the goal's
yeah.
still the goal. We want to increase access. We want to improve health. We want to have more kids coming to school. We want to, the basics. And instead of working on a plan for that, we rebadge from the Department of Justice to the Ministry of Justice. And we spend millions of dollars just
Yeah,
changing
yeah,
one word on the logo. And I'm like, okay, so that was my
yeah,
introduction as
yeah.
a 21, 22-year old, and became pretty cynical pretty quickly with the way government services work.
Well, and that's the thing, right? You end up like I see people that have been in health for 20 plus years, and I'm just like, man, how do you like? And that's often my question to them: how do you deal with that? Because it is such a thing. Like when you're so focused on wanting to get outcomes and wanting to try and improve service and make it more accessible and all of those good things, like when something comes in that's just clearly not going to help push towards that goal, and as you say, it's like tinkering around the edges with what the logo looks like, to be a pretty blunt example, and but it happens. It's like, well, like, yeah, how do you just keep coming back and trying to focus on that? And I think that's kind of the key if you're in those kind of departments and things mentally, is you still have to keep your focus
Yep.
where it is and realize that unfortunately some of it is out of your control, and I think that's probably the part that I have had frustrations with, is just dealing with that piece and realizing that, hey, you work for this organization, but you might not necessarily, that doesn't mean you have to agree with everything they do, right? Like you might have a different perspective and you would probably provide different advice to whoever it is that's asking you for your opinion. But at the end of the day, you are still, an agent employed by them to implement whatever the decision is that is made. And yeah, I don't
Yep.
know. I found that quite hard at times. And I think if I end up back in there, it'll be more of a matter of trying to give my advice and my opinion, but being able to step back and say, okay, like you've done your bit. This is the way that we're going, and this is what we're going to have to do. And, suck it up, princess type scenario to an extent, and do your job, because at the end of the day, it's your job and you're employed to do that. And yep, you can give advice, and that's a good thing. Give your advice when you can. And if it's not, if your advice isn't considered the best advice, you have to be able to live with that. And I think that's what the people who are in those systems for a
Yep.
long, long period of time get really good at, right? But as you say, there is a bit of cynicism in there, and you do see a little bit of that. But by and large, everyone I've seen in those health systems wants better outcomes. They want better equity. They want results that are improving. And yeah, I think it's just the nature of the system, and it's a really
Oh
big,
yeah.
complex beast. And from the outside, when you look in at one of these systems, you think you know the answers, and then you get in there and you think, well, if I tinker with that, that changes. If we tinker with this, that changes. If we like, it's like the argument of tax the wealthy, and you're like,
Yeah.
people are like, yeah, but if you tax
Yeah.
the wealthy, look what's
Yeah.
happened overseas, they've left. And it's like, where is the simple answers here? And then that's why you realize, I think, that there isn't one answer and there isn't one right way to do it, and everything that you may choose to do will have trade-offs, and you might think it's the best way, and then it actually gets implemented and you realize there might have been some blind spots that you hadn't realized were there. So yeah, it's interesting, and I have enjoyed being in the system. And I think one of the things that I would say, about both the health and education systems from my experiences is, like, everyone who I've ever met who's on the front line, by and large, 90, 99, probably almost 100% of those people, like, they really do actually care, and they really do actually want to make it better. And like, my wife is a primary school teacher, and whenever you hear anyone bagging teachers, like, you can just see
Oh yeah.
the frustration, because they'll say something that's just, some chump on talkback has said something, and it's actually wholly untrue as to what they've been doing in the system, but it's the way that it's perceived from the outside. And it's like, well, actually, we have been trying to do A, B, and C, and it's not as simple as that person has said on the radio, and this is why. And yeah, I mean, sometimes you have to make big changes and take big swings and do those sorts of things, but by and large as well, the people that are in there are just trying to do the best they can, and they're trying to make a difference in their kids' lives or in their patients' lives. And